from the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
Hi, I'm Danette Smith, CEO of the Nebraska Department of Health and Human Services. DHHS wants to remind you of the 6 rules to keep Nebraska healthy for the next 21 days. Number 1, stay home when possible. Run only essential errands and avoid social outings. Number 2, socially distance your work. Be sure to use the 6-foot rule as much as possible in the workplace. Number 3, shop alone. Avoid making trips to the grocery store in groups. Designate one person to go once a week. Number 4, help kids social distance. Play at home, stay away from playgrounds and team sports to keep children and families safe from the spread. Number 5, help seniors stay at home. Avoid going to long-term care facilities and utilize virtual visiting when possible. Send care packages with essentials when necessary. And finally, number 6, exercise daily. Do your best every day to stay healthy and safe. Help us help people in Nebraska live better lives.
Hi everyone, I'm Kathy Wyatt. Welcome to the 9th edition of a special weekly series on Consider This, COVID-19. Today's focus, where are we now? Joining us with some answers is Dr. Jeffrey Gold. Dr. Gold is a nationally recognized leader and tireless advocate for transforming education, academic medicine, and healthcare delivery. He is the Chancellor of UNMC and UNO. Thank you so much for being here and welcome.
It's a great pleasure, Kathy. Thanks so much for having me.
You bet. I want to start with that opening video. We're officially outside that 21-day period now, ending April 30th. How did we do with all that?
Well, I think we did reasonably well. Certainly it was timely and appropriate to make these important recommendations and requests of Nebraskans. And I think Danette Smith said it very well in the video, because those are among the most important things that we have done and been able to do. But I think we've entered into a new period now. And I think people are really itching to get out. The weather's getting warmer. People have things that they want to do and need to do. Certainly our farmers and ranchers have things that they need to do out in rural Nebraska. And many of our businesses, our school-age children, etc., have responsibilities and things that they've been planning to do when the weather got warmer as well. So we're in a truly transformational period right now, a time of change and a very careful watch and wait moment for Nebraska.
Yeah, and when we talk about watching and waiting, one of the things that we see on the news every day are the numbers. Mm-hmm. So what is it when we're looking at those numbers? How can we really gauge where we are with this virus? What's important to know?
Well, I think we have to realize that this virus is not going to go away, at least not in any time soon. And so we're going to continually see increased in numbers of people that are confirmed infected. As a matter of fact, it may get to the point that we actually stop sharing that information because no one will care about it anymore. For instance, we don't publish the number of flu cases that we see in a year, except in summary portion. You don't see it every day on the evening news. And so we're going to be monitoring this. We, the university, that is, particularly UNMC, tracks this data every single day, holidays, weekends, etc. And there are 6 critical factors that we look at on a daily basis. And that is the number of new confirmed cases, COVID confirmed cases every day, the percent positive tests, not the total number of positive tests, but the percent that are positive, the number of confirmed COVID-related deaths, which unfortunately continues to go up every day. Those are what we call the disease-related parameters. And then there are 3 resource-related parameters, and those that are the total number of hospital beds that are utilized for COVID patients, the total number of intensive care unit beds that are utilized for COVID-confirmed patients, and then finally the number of ventilators that are in use in the state for COVID-positive patients. And we do this for the state, We do it for the 6 healthcare collaboratives, and we do it for the 19 local public health districts across the state. Because, as you might imagine, what's happening in the Panhandle is not identical to what's happening in Broken Bow, and what's happening in Broken Bow is not the same as what's happening in Fremont, and what's happening in Fremont certainly not the same as what's happening here in Omaha. And so we track all of this on a day-by-day basis and share that information widely with our elected officials, with Danette Smith that we just heard from, as well as our own public health team.
Okay, and one of the things that we had heard so much, especially in the beginning, was that our goal was to flatten the curve, right?
Sure.
Everybody has a part in that, but I wanted to ask you, whose role is most significant in your opinion, and why, when it comes to getting that done?
Well, flattening the curve, as this graphic so nicely shows, is about reducing the total number of infected patients and individuals that could need health care, meaning showing up in clinics, being hospitalized, needing intensive care, needing ventilators. You know, because as we've seen in other parts of the world, particularly initially in Italy and then most recently in New York City, that when you start to get close to the capacity of the healthcare system or exceed the capacity of the healthcare system, the most vulnerable members of our population, meaning the older individuals, people with what we call comorbidities, which means diabetes, high blood pressure, lung disease, heart disease, etc., can't get the care they need. And that produces long-time suffering and tragically sometimes even produces death. And so have we been able to flatten the curve here in Nebraska? I think we have. But are we done? You know, not yet. And I mean that in the best possible sense, because to come back to your critical question, the question that you asked me is who owns this? Where's the responsibility? It's a blend. It's a blend of what our governor and what our legislature and what people in the public health expertise communicate, to a large extent the information that I'm able to share on a periodic basis. But at the end of the day, it's an individual decision because the reason that I choose to wear a mask is not just to protect me, but frankly to send a very strong message that I'm protecting others. Because, you know, one of the unusual things about this virus, Kathy, is there are an awful lot of people who are infected that don't know it. But they are carrying live virus with them. And that means if they cough, they sneeze. You know, there was this recent story about this choir, you know, where, you know, almost 100 people got infected from one person in choir practice who was not coughing or sneezing or anything, you know, along those lines. And so if I can protect you, and if so doing, I can protect your friends, your family members, etc., by wearing a mask, by being a full 6 feet apart, as you and I are now. And by the way, there's no magic to the number 6. You know, 6 is probably better than 5, and 5 is not as good as 8, you know. And I guess if we were on different sides of the campus, we wouldn't be able to do this broadcast, so we have to be practical at some level. But hand washing, cleansing of surfaces, what I like to call physical distancing. I actually don't like the phrase social distancing because we need to be socially connected, but physically distant for this. And the other things that Danette Smith articulated about shopping, childcare, I think exercising daily. I get my exercise in almost 7 days a week now, and it's a really important thing for me to get my 20 or 30 minutes. And I miss it when I can't. And actually, fortunately, I've got the time now that I can do it because I'm not traveling anywhere near as much as I used to.
Right, right. Well, and so that gets into my next question. There are folks out there who thought when we started reopening, we were reopening too soon. And then, of course, others thought we hadn't opened soon enough. And you're going back to that personal responsibility. How do you answer that when somebody says, Dr. Gold, where were we with all of this? Was it too soon? Was it not soon enough? Where were you when we started opening things up? Were you comfortable with that as long as people complied?
So, as I sit here today, Kathy, I don't know whether we're in the 7th inning, the 5th inning, or the 2nd inning of this ball game. But I do know this, that the social responsibility that we have for each other is going to be tested on a day-by-day basis. Because until there is an effective vaccine, And until there's an effective antiviral, or more than one vaccine, or more than one antiviral, the only effective means that we have of combating this is through the NPIs, the non-pharmacologic interventions. And those are things that you and I choose to do and choose not to do.
Okay, I want to go back into then. So we had our businesses, restaurants, salons opening back up again. For those of us who frequent those businesses, is there something that we should be looking for when we walk through the doors? I can go to a grocery store, for instance, and I can see arrows on the floor trying to encourage people to walk a certain way.
And most do.
Right.
Not all, but most.
Right, and some places are taking your temperature. I mean, is there something I should be looking for that tells me, maybe not yet in this particular?
So when I choose to frequent a restaurant or go to the grocery store or a pharmacy or whatever, the things you mentioned are what I'm looking for. I'm looking for to make sure that the staff are wearing a mask, that they're doing their best to maintain social distancing, that there's signage, that there are markers at the checkout, that there are barriers between the people who are brave enough to come to work and check us out in the grocery or wherever are protected from us, and we're protected from them. I'm looking for just a sense of awareness, and I'm also, constantly looking for cleanliness, surface cleansing and things of that nature. Gives me a great deal of confidence to go into a grocery store and see one of their people with a hand sanitizer cleaning the handrail on their grocery carts. I mean, that means a lot to me. It means that they care. And if they care at that level, they probably care at the other levels as well, in terms of keeping their employees healthy, making sure that if an employee is ill, that they encourage them to stay home as opposed to encourage them to come to work. If they're taking care of a sick family member, that they have access to testing and screening. And all of that's, the messaging that I'm looking for.
Okay, is there a question in particular that we could ask a business that would tell us that not only are they complying? I know the other question that's come up with folks is the enforcement piece. So you might have your policies and procedures in place, but then that question becomes, who's enforcing all of this, right?
Well, that's where we get into this ethical, moral dilemma of people, because at the end of the day, there will never be enough law enforcement, first responders, and others to go into every restaurant, every bar, every health club, every park, every social gathering, etc., and say, too much. You're not doing this, you're not doing that. I mean, that's where the ethical responsibility comes in, of saying, I really care about your family and about you. And I really care about the people that I work with on a daily basis. And I really care about their families, because I know that almost all of them have older parents or grandparents. I know many of them, either themselves or their families, have some type of chronic illness. The good news about American healthcare is we're keeping people alive and vibrant and healthy longer. The difficult news is many of them take medications. Many of them have chronic illnesses that have to be considered, and we need to protect them.
Okay, and that leads right into that whole me versus we, right? The individuals, good people, who are out there and thinking, well, I feel okay, so it'll be all right because I'll if I contract this, I'll get over it, I'll be fine. If there are still people watching who maybe aren't wearing the mask, who aren't really maybe being as conscientious,
and I'm sure there probably are,
as maybe we'd like for everybody to be, is there a story or something that comes to mind for you to at least get people to try to think a little differently, especially at this juncture of the virus?
Well, there are a lot of stories, Kathy. I mean, I have personal friends who not only got sick, but were hospitalized, ended up in an intensive care unit, and tragically passed away. There was recently a very well reported story of a young physician in New York City, a brilliant young lady who ended up taking her life because of the experiences that she was having in the emergency department and the helplessness that she felt in caring for what appeared to her to be an endless stream of patients with COVID-19. Just absolutely tragic. And then I read about the hundreds of children who have this new inflammatory disease that looks a bit like what's known as Kawasaki syndrome, which is clearly associated with the ramifications of the COVID-19 infection. And there have been deaths, from the very young ages up until 18 from this syndrome as well. There is no age restriction. There is no sense that, I'm young and I'm healthy and I'm going to be fine. To the contrary, there's no assurance of any of that. We know that people who are older, people with these comorbidities of diabetes and heart disease and lung disease and other such things, people that have been treated for cancer, people that are on immunosuppressive drugs. There's actually an association with obesity now that's coming out of certain parts of our population, are at higher risk. But that doesn't mean the rest of us are at no risk. Now, one of the interesting things that we learned, particularly from the experiences on the Theodore Roosevelt aircraft carrier, was that there are a number of young men and young women serving on the aircraft carrier who turned out to test positive, who had no idea that they were sick. And that has to do with one of the unusual ways that this virus is spread, because even if people are going to get symptomatic, are going to develop shortness of breath, fever, chest pain, cough, sneezing, etc., there's a number of days before that very first symptom ever arises that you're shedding live virus, that you can make other people sick. And there's pretty good data that even when people are feeling well, looking well, feeling swell, ready to go back to work, go back to school, etc., that they may be still shedding communicable virus. And that's one of the unusual things about this disease. And so it just means that we all collectively own this. We have to be responsible for our own health, of course, for our family and those that we care about, our friends, our co-workers, but we also have to be equally responsible for people we've never met, and understanding that we're paying it forward, that someone's going to do the same thing for me and for my family who are at most risk.
Okay, I want to spend a few minutes talking about testing. You alluded to it.
Sure.
Where are we right now with testing? I know more people are being tested. What are researchers finding? Enlighten us with all of the most recent in terms of that.
So there are at least 3 different types of tests that I think are worth just briefly reviewing today for the audience. The original test is a PCR test, and what that is a test that looks for a specific genetic material that's identified with a COVID-19 causing virus. It looks for little fragments of RNA, which are the genetic code of these viruses, and if it says this is the unique RNA segment for COVID-19, you or I have COVID-19, or at least we have a fragment of RNA. The problem with this test is it certainly is very accurate at measuring the presence of RNA, but live viruses and dead viruses both have fragments of RNA. So you really can't tell whether the virus is alive or dead, but when you're coughing, sneezing, febrile, and otherwise sick, it's pretty good evidence that you're infected with the virus, and the virus is alive, at least for a period of time. The second type of test that is similar but not identical is called an antigen test. And this is a new type of test that's under development now that is looking for not the RNA, but is looking for surface proteins from these viruses. And you've probably seen these pictures of the virus that have these fancy little spikes. They're in some really beautiful artist renderings. I'm sure none of them are quite that beautiful in reality, but those spikes are made of protein. And those proteins have a very unique fingerprint, a very, very unique fingerprint. And there are now tests that have come out to identify that. And then the final type of test that is now being widely used across the country, what we call antibody or serologic tests. Now those are all blood tests, either from a blood drawer or from a finger stick, whereas the first 2 are either from a swab or a saliva test. But the serologic tests, the antibody tests, look for immunity. So when an individual becomes sick, they don't have any immunity or they wouldn't become sick, right? So it takes time for those antibody levels to rise and then plateau and hopefully sustain over a period of time. I mean, there are only 2 ways really to become immune to to any type of infectious agent, but particularly to COVID-19. One, of course, is to get the disease and have your body's innate immunity develop antibodies, both cellular and humoral treatments for the virus. And the second is to get immunized. And given the fact, we'll talk about vaccines, I hope, in a few minutes, but given the fact that there's no commercially available vaccine at this time, the way people get immunized to it is by having the infection, whether they know it or not. And so the combination of these three tests provides a pretty good picture of what's going on in the community. Now, in answer to your question again, yeah, the number of testing availability goes up. All of our large hospital systems are doing testing, at least they're doing PCR testing. There's scalable antibody testing that's going on now, particularly at Nebraska Medicine, where people want to know, if you had a really bad infection, in January or February, did you have COVID, or was it the flu, or was it a common cold, or if you're immune? And by the way, what does that mean? Because we don't even know if you have antibodies, how long they last, and whether they prevent you from getting reinfected, or whether they just make it a milder case if you're exposed to the COVID-19 virus in the future.
Okay. When you're talking about tests, I think of Test Nebraska. It's something that's been out there. Tell us a little bit about Test Nebraska.
Well, as I understand it, when the governor decided to move forward with Test Nebraska, the whole idea was to respond to the dramatic need for testing. Because the only way that we're really going to improve this, until there's an effective vaccine and a couple of good antiviral agents available, the best way that we have of improving the situation, of, quote, reopening safely, is to be able to test everybody that needs to be tested, and we'll talk about that in a second. And then, if you test positive, do what's called contact tracing. And what contact tracing means, if somebody tests positive, call them up, get online with them, and find out where you've been, who you've been with, particularly who are the most vulnerable ones, and be sure that they then get tested. And so, right now, certainly we want to test anybody that's been exposed to the virus. That is to say, if you were in a room, if you were in that choir practice with that individual we read about, you need to be tested, whether you're symptomatic or not, because if you're test positive, even if you're feeling perfectly well, you need to be quarantined. You need to be isolated, and for at least the 14 days of the ramp-up period to that. And again, there's nothing magic about 14. Most people who get exposed and do get symptomatic roughly between the 5th and 9th day of the exposure. And then typically the infection shedding of virus lasts another 7 to 10 days. It peaks at about 3 to 5, but continues to shed. As a matter of fact, when we were hosting individuals from the Diamond Princess, you may remember the Med Center's quarantine unit and isolation units hosted all of the infected American citizens who were brought back from Japan, who were on the Diamond Princess cruise ship. We had individuals that actually had detectable genetic material from viruses. Who knows whether they were going to infect anybody, but genetic material from viruses from between 4 and 6 weeks. And so there's no magic number about all of this. But that's why we've sort of stuck to the 14-day quarantine, 14-day isolation period. Otherwise, you'd be testing people forever, and you never quite know whether that tiny fragment of RNA that you scrape off of somebody's nasopharynx is live communicable virus, or whether it's just a piece of residual RNA from a dead chunk of virus.
Wow. Okay, we just have a few minutes remaining, and I want to get to the vaccine. Real briefly, though, tell us about the app.
Sure. Well, one of the things that we decided to do early on in this, and UNMC, the University of Nebraska Medical Center, and our Global Center for Health Security have really leaned forward on so many different ways, whether it was with repatriating people, American citizens from Wuhan City, the Diamond Princess, whether it had to do with irradiation. I mean, every time there was an opportunity to do something creative, we leaned in. And so one of the ideas that we collectively came up with is if we had a smartphone app that was available across all of the mobile platforms, you could screen yourself. Because there was a lot of difficulty getting people screened early on. They didn't have access to their doctors, their pharmacists, their nurses. They were afraid. They didn't want to communicate with anybody. And so the app is called One Check COVID. That's number 1-check COVID. It's available on both the Apple and the Android devices. And we are using it quite widely now, not only across the university system, but frankly quite widely across the United States. I think there are over 100,000 images that have been downloaded thus far. And we're in our 30th build, which means there have been 29 builds before that. And as I say, it's now available in both Apple and Android platforms. But the idea is you can self-screen. I'd ask you, do you have fever? Do you have chills? Do you have this? Do you have that? If the answer is yes of any of that, it asks you, what are your risk factors? Are you over 60 years of age? Do you have diabetes? Do you have hypertension? It asks you if you've ever been tested, either through serology or through PCR testing. And then it gives you a risk factor, either low, medium, or high. And then it's all based, by the way, on Centers for Disease Control and Prevention recommendations. So none of this is out of whole cloth. And then it makes a recommendation. You're screened, and it doesn't prescribe anything. It doesn't connect you anywhere. All it does, and it's completely private and personal, but all it does is tell you how you screen out and give you some feedback. And then it does one other really unique thing, which I think differentiates it from a host of other smartphone apps, and that is if, and only if, you want to share it with your physician, your clinic, your pharmacist, your nurse practitioner, whatever, you can do that. The same way you would share a photograph with a friend or a family. You can text it, you can email it, you can put it up on social media if you want to, whatever you might happen to want to do. But that's your decision, and it's completely private.
Okay. I regret to say we have less than 30 seconds left. I know we want to get to vaccines. Can we have you back, Dr. Goldis?
You can have me back anytime you want.
Thank you and thank you for taking the time to be with us and sharing your expertise. We so value that, and we so appreciate all that you and UNMC and Nebraska Medicine are doing. Thank you.
We're honored to play a part.
All right. And thank you all for watching. We will see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at netnebraska.org/considerthis. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.